Hi, my name is Anna Mendoza. I am an endocrinologist at St. Joe's Hospital. So January is coming up and is actually Thyroid Awareness Month. So I wanted to talk just briefly a few minutes about thyroid disease. As you know, thyroid diseases are very common, and thyroid nodules is one of the most common things that I see here. And actually, thyroid and parathyroid disease is one of my main interests. So, thyroid nodules usually are benign, and many of them are asymptomatic. They usually stay quite stable in size over years, and sometimes they don't need any additional treatment. But there are some thyroid nodules that may be increasing in size over time, and they become symptomatic, meaning that they can cause pressure locally, and hoarseness or some of the local symptoms. But sometimes people may be concerned about them because of cosmetic concerns. So these type of nodules are actually quite rare, but when they do increase in size, we do have to biopsy them, and this is just a fine needle aspiration to make sure that they're not thyroid cancer. Thyroid nodules, majority of them are solid, and there's another group that are cystic, which is not as common as the other ones. The cyst just means that it's full of fluid. Some of the thyroid nodules are solid and some are cystic. So when these thyroid nodules are causing compression symptoms and they are biopsied and they're benign, the solid nodules usually need to be surgically removed, and that would be how we treat them. One other option that we have would be that the cystic nodules, they can be aspirated, and that would relieve the pressure, and they would decrease in size. But we have noticed that some of those cysts can reaccumulate, and the fluid would reaccumulate, and the person would again have local symptoms. Again, this is not common, when that happens, I can inject alcohol into it. Over time, these nodules would decrease in size and they can shrink. So this actually is a nice procedure that can be done as an outpatient. I've recently learned how to do it, so it's a nice option, so that we don't have to recur to surgery. Of course, surgery is a last option. So this thyroid procedure is done in the office. It actually has very few complications, and it's one of the options that we have. So I hope this was useful for you for thyroid nodules, and look out for more information coming up in the rest of this month. Thank you.